From under the Golden Dome in Charleston, this is the West Virginia Capitol Report.
Well, hello everybody, and welcome to this week's edition of the Capitol Report. I'm Bill Laird along with co-host Dave Perry, and we're coming to you from the West Virginia State Legislature here in Charleston, the State Capitol building, where the 84th regular session of the West Virginia Legislature got underway recently with the governor's State of the State address. And again, as they say, the ball is off the tee, and it's that time of year. And we're very pleased to be joined with us today, a very special guest, a gentleman, David, we've known for quite some time.
Absolutely.
The Honorable Tim Miley, who represents Harrison County in the West Virginia Legislature and serves as a minority leader in the House of Delegates. And Tim, welcome to the Capitol Report Show.
Well, thanks for having me, guys.
You bet. And again, you had the opportunity to listen to the governor's State of the State address. Again, that's the annual opportunity the governor has to sort of outline, either in broad strokes or in some level of detail, perhaps what his programs initiatives will be in the upcoming regular session. If you could share with us generally your impression of the governor's address and where you think that's headed.
Sure. And I have very mixed feelings following his address, and that is because I didn't hear a lot of vision for the future of the state, and certainly no policy to implement any such vision if he even shared any, which he did not. What he spent a lot of time doing was talking about how great the shape of the state is in and why he thinks that's going to continue. And just to be clear, he's all of our governor, and so I want to support the efforts he does to move the state forward, because it benefits not just the citizens that we represent, but also the three of us as well, and our families. And so I always want to support the governor, but I was concerned that he tried to present and paint a rosier picture of the condition of our state than what I believe actually exists. And let me explain what I mean. If you drive around the state to all of the small towns we have in our communities, they are dying. I don't know of very many that are thriving. Maybe in Morgantown, maybe in the Eastern Panhandle, but right here in Charleston, we are losing population. We have lost, in the past 5 years, 57,516 people in this state, some of whom have just died, others of whom just left the state. But things are not going well in this state. Families are hurting. Downtown Clarksburg, my hometown, it looks like it's a ghost town at times. There's a lot of shuttered storefronts, empty buildings. Go around to the suburbs of Clarksburg and you see a lot of older, dilapidated, vacant homes. And that's Harrison County. Imagine what's going on in some of the more rural counties. And I know you guys are both from Fayette County, and I can't speak to what's going on down there. But our state is decaying and dying from the inside out. And he can say what he wants about how well the state is doing. There are a lot of families hurting. And what I want to ask is, how can you sit there and talk about how well our state is doing, while in the same speech talk about a hunger crisis that we have in our state among our children that you're devoting several $1 million to? You can't have it both ways. You can't have your cake and eat it too. On one hand, claiming how great things are while we have this serious hunger problem. I mean, that's just unfathomable in the 21st century anywhere in this country. But we have it right here in West Virginia. Earlier in the week, I saw a statistic where over 70% of kids in Logan County are living with their grandparents, and that's probably due to the fact that so many of the parents have lost their parental rights due to abuseful or neglectful situations based upon opioid use, probably. And so there was a disconnect when he was talking about how great the shape of the state is in versus what I believe to be the reality. And if he gets around and drives around the state, he would see the same reality that the three of us see when we're out and about.
Right. Well, is it fair to say, and again, my sense, there perhaps are some pockets of comparative prosperity in West Virginia. Obviously, the Eastern Panhandle's little growth in population. You mentioned Morgantown. You made reference Last night to this regional airport in north central West Virginia. You know, there are some little pockets of growth and prosperity, but in general I can say from the perspective of the coal fields of southern West Virginia, it's pretty tough.
Well, it is, and you are right. There are pockets of prosperity, but even that's relative. Yes, in Harrison County we have a very successful airport that supports a big aerospace industry, and it has $1 billion economic impact. And thank goodness, because that's holding up our economy up there. In Morgantown, or Mon County, I should say, you have the university, you have 2 hospital systems, you have Miley Pharmaceuticals and other governmental agencies that are located there. So it's understandable that that is growing, but the growth is occurring only in very discrete pockets. And you don't even have to get as far down as the southern coal fields. Central West Virginia. Have you been to Sutton lately? There's not much in Sutton, in Braxton County, Webster Springs. I mean, you don't have to get as far down as the southern coal fields.
Right.
It's in central West Virginia as well.
Yeah.
And so I think we need to be honest with ourselves, Bill, about where we are. We all know where we want to get.
Sure.
There's 3 components to that. You have to know where you want to get. I think we all can agree to that, economic prosperity. You have to know where you're at to begin the journey to economic prosperity, and then you have to figure out how you're going to get there. But if you're not honest with yourself about where you even need to begin and what's needed currently, you'll never get to how to get there, and you'll never certainly reach your destination.
Right.
Tim, of course, 2 of the primary sections of the governor's state of the state was the inventory tax and the intermediate court. And I know the intermediate court was suggested under Speaker Thompson and even during your tenure. What's your feelings on that relevant to intermediate court and the inventory tax?
Well, let me first address the inventory court, the intermediate court. It's unnecessary, it's governmental waste, and all it does is create another layer of a court system that our citizens will have to be drugged through. Because make no mistake, it's being implemented to starve out individuals who have to go through the court system. Because the large companies and insurance companies and corporations, they have the money to be in the court system for years. All this does, if you add another layer in the middle, it just stretches out someone's participation in our court system, which obviously comes at a cost, number one. Number 2, it's going to cost the state. There have been estimates between $10 and $15 million every year for a court that's not needed. I suggest we put that money into building out broadband, feeding some of these kids, helping some of these communities that are so desperately in need of help. And excuse me, finally, we're losing population. The court case numbers are going down. So why would we implement another court system to lengthen the process in our judiciary system, cost more while the numbers are going down? It makes no sense. It's being done because the National Chamber of Commerce, once again, as typical in West Virginia, out-of-state corporations want this. The citizens don't want it, the citizens don't need it, and the citizens shouldn't have to pay for it. But this is something that, yet again, the Republican majority wants outside corporate interests to dictate what we do here in West Virginia. With regard to the equipment and inventory tax, look, everybody that I've talked to believes the tax is kind of goofy and can't understand why it exists in the first place, which, by the way, was put into our Constitution decades ago, long before you and I were probably born. Well, at least long before I was born.
Right.
But here's the thing. The money generated from the business equipment and inventory tax primarily goes to each of our counties and into the county school systems. So if we eliminated that tax, we would eliminate the funding for our local school systems. So what happens? Either our school systems crumble, or we find the money elsewhere to support our school systems. Well, we're not going to let our school systems crumble. The counties won't. So what will they have to do? They'll have to increase the property taxes on your home. That's what they do in other states. Part of the allure and appeal to West Virginia is the low cost of living, which includes, of course, low property taxes. But if you get rid of the business equipment and inventory tax, which results in higher property taxes, and it will, to maintain your school systems, who does that burden fall on? It falls primarily on the elderly who are retired on fixed incomes, who quite frankly, in my opinion, are already struggling with keeping up and maintaining their homes, many of which are very old homes, 50, 75-year-old homes, because they've lived in them for quite some time. And so you're going to put an additional burden on them, all because we want to take care of out-of-state corporate interests. I'm not for it in its current form. I would consider being for it if they identified a source of revenue to replace what would be lost so that your property taxes won't go up, but they haven't done that. And this has been talked about for years. When we were in the majority as Democrats, we looked into getting rid of it. It can't be done because it brings in too much money. If they're willing to identify another revenue source to replace what's lost, we're all for it. But they haven't done that because they can't do that.
Of course, we don't want to get too partisan, but we've heard the Republican agenda to a certain degree through the speech by the governor last night. What's the Democrats proposing, or what would you like to see happen from a Democratic perspective, or Democrat perspective?
Sure, and ours is pretty basic and common sense. Our platform and position this session is putting West Virginians first. West Virginians first needs to be the prism through which all legislation should pass as far as we're concerned. Whenever any policy or legislation or bill or amendment is offered, we are going to ask, is this putting West Virginians first, or is this putting some corporate outside the state interest first? Now, the likely response is, well, we need to please these outside corporate interests so they come to West Virginia, and ultimately it will benefit West Virginians. I'm tired of buying the pig in the poke, so to speak, hoping that someday West Virginians will benefit. We have to start passing legislation that puts West Virginians first, and by doing so, we believe we will keep people in the state. As I mentioned earlier, in the past 5 years, we've lost 57,516 people, and when they do the census next year, or this year I guess is 2020, we will find out that we've lost more. I think they're predicting that from 2010 to 2020, we will have lost close to 70,000 people. And so our agenda is designed to put West Virginians first, and let me briefly go through some of the highlights. We summarized by talking about renewing opportunities, rebuilding West Virginia, and restoring healthy communities. Let me talk briefly about renewing the opportunities here in West Virginia. That would be expanding workforce preparation by offering a vocational curriculum in middle schools. I think sometimes we overlook the fact that trade skills are greatly needed but don't exist out there because we don't have enough students who are being encouraged to pursue their dreams in plumbing, heating, HVAC work, all of which are basic skills that need to be out there in our communities. So we want to do that. We want to support training for coal miners that lose their jobs. We know that coal mines have closed down even during the Trump years. So he's not done a whole lot for West Virginia yet. I'm still waiting for that. So we want to see what we can do to help retrain them. Now, unlike what's been said in the national media, I'm not expecting a coal miner to lose their job in the coal mines and all of a sudden go start learning how to be computer programmers.
Right.
That's just not going to happen. But they might have some mechanical skills that will allow them to become very successful tradesmen and women. Rebuild West Virginia. We want to continue supporting broadband expansion. We believe that's critical to the future success of our state. In any other part of our country where they are finding success, people have access to high-speed internet. Nowadays, that's a given. That's an expectation. If we want to attract the next generation of workers to our state, many of whom will be working remotely, they expect to have access to high-speed internet, and we don't have it in all parts of our state. Let me see another one. One of the things, let me give credit where credit is due, and I will give credit to Governor Justice. He is going to fully fund the IDD waiver program to take those vulnerable people off the wait list.
And it was 1,000, wasn't it?
Over 1,000 disabled individuals, mostly children, but not necessarily children, in our state were on a waiting list for services. And he is going to fund that with, I think, between $15 and $20 million to make sure that waiting list is cleared off. So that's worthy of respect and admiration and compliment. He's going to hire more CPS workers because there's a tremendous need for child protective services in our state because it's a growing problem. Most of us are aware of it with regard to foster care kids who are in foster care and the situation involving that program. It's atrocious, and we've got to get a handle on it.
Well, Tim, unfortunately our time has expired, but I really want to thank you for taking the time out to sit and talk to Dave and I about the upcoming legislative session, and I want to wish you all good luck in the upcoming 60-day session.
Well, thanks for having me. I appreciate it, and I'll be happy to come back anytime you want me to.
Certainly.
If
Thank
I can
you,
add
Tim.
something to your program.
Okay, there you have it. The Minority Leader in the West Virginia House of Delegates, Mr. Tim Miley from Harrison County, joining us today on the Capitol Report Show. We're going to go ahead and take a quick break, and Dave and I will be right back, so stay with us, everybody.
Stay tuned. The West Virginia Capitol Report will be right back. The West Virginia Capitol Report is brought to you by the AFL-CIO of West Virginia, Cucumber & Company, online at cucumberandcompany.com, and Mark Hunt & Associates, toll free at 800-554-1280. From under the Golden Dome in Charleston, this is the West Virginia Capitol Report.
Welcome back to the Capitol Report as we continue our discussion about major items related to the upcoming 84th meeting, annual regular session of the West Virginia Legislature currently underway, and we're very pleased to be joined at this time by a very good friend of the Capitol Report show, a fellow we've known for quite some time, Dave.
Yes.
The Honorable State Senator Ron Stollings, who represents the 7th Senatorial District in the West Virginia Legislature, good resident of Madison, Boone County, our good friend Dr. Ron Stollings. And Ron, welcome to the Capitol Report show.
Thanks, Bill. Thanks for having me.
You bet.
Appreciate it.
Again, you had the opportunity to hear the governor's State of the State last night. Again, his annual opportunity to outline program initiatives in the upcoming session. From your perspective, particularly as it relates to public health issues and matters that you are truly a leader in this legislature on, what was your general overall impression concerning the content of that State of the State?
Well, as always, there's good and bad. I'm so happy that we're going to try to enhance child protective services, but we shouldn't have been in this bad a condition to begin with. If you remember, over the past 3 or 4 years, they continually cut the DHHR budget, the leadership, and that included birth to 3, foster care, CPS, mental health treatment, in order to balance the budget. In fact, the numbers are $207 million out of the base budget. So now we're behind the 8 ball, obviously, with this terrible foster care crisis, and I would call it a child health crisis, where you have 100,000 West Virginia children, or I'm sorry, 10,000 West Virginia children homeless. You have 7,000 people in foster care, and about 200 missing. So the fact that we have to go back and add 80 CPS workers, thank goodness they're doing it. Is necessary? Is it enough? We had a lot of foster parents here today talking about kinship care, talking about foster care in general. We only pay kinship people $200 a month to care for these children whose their biological parents are not in the home. So we have a lot of heavy lifting to do. Again, as other people have said, getting that IDD waiver backlog cleared off. That's good. That's big. It needed to happen, and I appreciate that. So there's some good in there. But again, I think we're kind of treating the symptoms sometimes and not the underlying cause of a lot of our problems.
What type of persons are we talking about when we're talking about student or persons on the IDD waivers, Ron?
Well, these are disabled people that would otherwise be in a nursing home per se, if not for being able to be cared for in their home. So there's disabled folks, geriatric folks. And again, people want to age in place, so this allows people to be in their home and be cared for, with high touch, and usually that's lower cost, high touch, low tech, if you would, so that they would be able to be cared for and age in place in their own homes.
Again, as the minority party, which plays an important role in the legislative process, but I understand the Senate Democrats, in concert with your counterparts on the House side, got together and worked in a general sense of, I think it's putting West Virginia first was the title of the platform. But you all did a lot of work in putting together your vision as to the programs that would help advance the state. And an important part of that was to restore healthy communities. And again, I know there's a lot that goes into that subtitle, but tell us a little bit about that important area of working toward the restoration of healthy communities in the state in which we live.
Yeah, thank you. Again, we have had a fairly significant substance use disorder. And so we absolutely know now that these adverse childhood experiences, this ACE score that children have, people that have a high ACE score really have bad health outcomes and also bad educational outcomes. So we need to expand these ACE screenings, maybe universal screenings for our children. We need to increase funding for our drug-free mother-baby programs and expand the Birth to 3 program where again, we know as physicians and educators that if you don't have a pretty good vocabulary by the time you're 3 years old, guess what? You're going to be impaired as far as your ability to learn. And so the early investment, and again, support prevention efforts by funding after school and summer programs. We know that idle minds, end up,
of the devil.
Is the work of the devil. So those are some of the big things that we talked about. And then, we've also heard so much about how much it costs just for insulin. And the state of West Virginia has a huge diabetic burden. And so when people are having to pay $1,000 a month for insulin, guess what? They're not going to have money for other things. So, we want to cap the co-pays on insulin. And obviously we have to protect our coverage for pre-existing conditions. We need, one way to raise some money that's, again, the federal government's shoving out a lot of money for this opioid or substance use treatment. We need to make sure we get the biggest bang for the buck on that. And again, we're talking about the entire continuum of recovery, not just medication-assisted treatment, but educating these people, reintegrating these people into society, and that's going to be a heavy lift. And the other thing is, we just have to try to look at what we're feeding our people. We need fresh fruits and vegetables, and so anything we can do, farm to table, farm to school, any of those things like that would really be beneficial to us.
It's so important. And again, the governor made some reference last night. I'm not sure I totally caught it, but maybe some excess Medicaid funds that have been identified. But again, I know that you have a real finger on the pulse of the strength of our provider system, the importance, fundamental importance of access. The federally rural qualified health centers throughout the state, those providers that currently accept Medicaid. If you could, maybe just from Senator Ron Stollings' standpoint, the importance of the strength of our provider system and how Medicaid funding is an element in that.
Yeah. Well, thank you. Again, that's a very important question. He mentioned last night that we had about a $309 million Medicaid surplus. Now, what that means with a 3-to-1 federal match, that's right at $1 billion,
right.
Okay? And I question why we would have a $309 million surplus when our hospitals are closing, We've had 3 hospitals closing, and I bet you're going to hear something more in the very near future. So when the hospitals bill $1, Medicaid reimburses them sometimes 30 cents on the dollar, or and so that's below the cost of delivering the care. Same thing with emergency ambulances and stuff. Last year, they added a little bit of funding to that because there were about 70 ambulance services closed because guess what? About a third or more of the runs are Medicaid runs, and they were only paying 19 cents on the dollar.
Wow.
Now you think about that. Wow. And West Virginia, unfortunately, out of the 1.8 million people here, 1.1 million are insured by government payer insurance. Medicare for our seniors, Medicaid for our poor, and PEIA for our state employees.
The West Virginia Capital Report is brought to you by the AFL-CIO of West Virginia, Cucumber and Company, online at cucumberandcompany.com, and Mark Hunt and Associates, toll free at 800-554-1280.
Welcome back to the Capitol Report as we close out today's show. And again, Dave, we want to thank our guests. People get kind of busy here at the Capitol at the beginning of the legislative session. Again, the Finance Committee is meeting, hearing the budget proposals from the various agencies in state government. A lot of bills still in the making, but again, the things are underway, and look forward to working with you to bring up-to-date coverage concerning the work of the legislature to our viewers each week.
Absolutely, Bill, over the next 60 days, and bring additional clarification so the general public will understand.
Absolutely, and some of the times we understand,
Exactly.
Sometimes maybe not.
Maybe
but
not.
Again, to the viewers, we'd like to thank you all for tuning us in each week on the West Virginia Capitol Report. Have a good week, and goodbye, everybody.
This has been the West Virginia Capital Report.